This is the NP Advocate podcast, where frontline clinicians share the real human stories behind the barriers in our healthcare system. These nurse practitioners are powerful advocates for themselves, their profession, and most importantly, for their patients. I'm Laura Starr, fellow nurse practitioner, and your host. Welcome to the NP Advocate. Hi, Robyn. Thanks for joining today.
Great. Thanks so much for having me. This is exciting.
Yeah. I'm so happy you could make the time. So you are a pediatric nurse practitioner, and you also worked really hard with your daughter to get Addie's bill passed. And that's largely what we're going to be talking about today. But first, could you tell me a little bit about your clinical practice and how long you've been a nurse practitioner, or how long you've been a nurse?
Yeah. So I am, born and raised in San Francisco, started out as a pediatric ICU nurse, was working at UCSF and, did my NP program over there at UCSF as well. I started as an NP in 2008 and went into pediatric surgery at UCSF. And I was really interested at that time in doing kind of teaching and education. So I went back right away and got my DNP at USF and focused at that point, because I loved critical care still from my PICU days, really wanted to develop and see a role of a nurse practitioner working in the PICU, which was really well established on the East Coast, but not yet on the West Coast at that time.
Yeah.
And so that was my doctorate project. That was my DNP project of implementing that role. So that was really exciting. We got it funded. I was one of the first PICU NPs at UCSF. It was a combined transport PICU role. Kind of a mini startup, if you will. It was really exciting. And then I got married, moved to Sacramento. My husband's job was out here, went back to pediatric surgery here at UC Davis. So I've been here since 2013. And it's been really, really interesting. I think, again, kind of like a little startup too. We started out really small. I helped open the Shriners Pediatric Surgery Program with Dr. Farmer, who I worked with at UCSF.
Oh, nice.
To develop that program. Then worked solely at UC Davis on the inpatient/outpatient service, and now currently just working in ambulatory in the outpatient world.
Are you a pediatric primary or acute care?
Yeah, good question. I'm in acute care.
Okay, nice. That's a rare breed. I don't meet too many pediatric acute care NPs. So, because it's so rare, like there's so few programs.
There are, yeah. And UCSF was still having that program when I was going through. So I was really fortunate. But, I think PNPs are kind of a small percentage of NPs. I heard a stat the other day that was just 8%. So I actually didn't realize it was that low. And then you add on acute care, it's even a smaller percentage. But also East Coast trained, the way we're used is just so different, East Coast versus West Coast, but family keeps us out here. So, so what is what does a normal day look like for you right now? Yeah. So, basically I work in ambulatory. So, I start later than my 7 a.m. starting rounds, like my inpatient days, but start around 9. I help with the clinic functions, lots of video visits, in-person visits, lots of follow-up with our kind of long-term pediatric surgery patients as well, and acute care follow-up from kind of NICU discharges or trauma follow-up and things like that. And a lot of, helping kind of bridge the care coordination to working alongside with our nurses. So it's a really interesting role. Pediatric surgery deals with a lot of different diagnoses, some, very, kind of short-term appies, hernias, easy little bumps and things like that, to kind of the oncologic cases, the congenital cases from the newborn nursery that we really follow them long-term, have really complex care. So it's really exciting. I love the breadth and depth of pediatric surgery. So really enjoy that practice.
Yeah, that's great. That does sound like a very broad patient population.
Yeah, we get to work with all specialties too, which is really nice.
Yeah, that's cool. That's such a cool role. So you worked on Addie's bill with your daughter, who's named Addie. Yep, but it's not spelled quite the same as the bill, because we got creative with acronyms, which is fun.
Exactly. Yeah. So it stands for Allergen Disclosure for Dining Experiences. So ADDE. And her name is spelled ADDIE. So it was actually, but it worked out perfectly. And so we called it the Addie bill for short, but it's SB 68. So California Senate Bill 68.
And what exactly does this bill do for food allergies?
Yeah. So, my daughter, just to back up a little bit, she, we found out she had severe food allergies when she was an infant, terrible eczema, lots of terrible reflux, weight gain issues. And, being a pediatric NP, I was like, oh, it's probably not that bad. But again, I'm not primary care, right? So don't see the run of the mill eczema. And I was trying to downplay it, thinking maybe it's just me being paranoid, right? But it was like, it looks pretty severe, but I don't know. And so, she looked like a burn victim at one point. It was really bad. Found out she had bad food allergies. She was actually reacting to my breast milk. So, top 9 food allergies is what's recognized by the FDA. Sesame was the last one to be included more recently. And, the number one thing you have to do as a food allergy patient is avoid your allergens, of course, right? But when you go out to restaurants, how do you know what's in your food to be able to avoid that safely, right? So that was really what I learned with Addie, trying to navigate her world with her when she was growing up. And even now, still, it's just such a struggle. So often you go out, you ask the questions, does this contain XYZ? They usually try their best effort to give you that information. But often they don't know, and you're not sure if you can trust it. But when it's written down, so much more reliable that you can still verbally verify, but also check in writing, just as you would before a blood transfusion, right? You want to double check everything, just like we were trained as nurses. So anyways, found out that this was definitely lacking. We did the research and found out, wow, okay, this doesn't exist anywhere in the US. But actually in the EU, it's been in existence for the last decade, mandate that restaurants have to label the top 9 allergens on their menu. Actually, in the EU, they labeled the top 14.
Oh, wow.
So what SB 68 was asking was, can we require all restaurants in California to label the top 9 allergens on their menu so that it's clearly disclosed and identified? Just what the food does contain. So we're not asking about cross-contamination, just does this dish have milk, nuts, egg, right? Very
Seems
simple. We're not asking
yeah.
for calories. We're just asking for, what does this food item contain? So that was our bill.
Okay. What, like, when was there a moment where you're like, there was something that you found in a food, or like, was there a moment where you're like, we need to change this? This needs to happen?
Yeah. I think we actually had several kind of mini experiences, you will. And the real experience that led to this was actually a positive one. So often you hear, there's obviously a lot of deaths that occur or a terrible reaction. We have had reactions before. We actually had a terrible near miss. This was my first experience with this. She was, I think, a toddler, probably 2 or 3 years old, brought her out to brunch in Sacramento, ordered a hash brown because at that time she was allergic to like everything, I would say, like top 7 of the 9. And so potatoes were safe.
Yeah.
And so we did hash browns, and I said, hey, just double checking, she's allergic to all nuts. There's no nuts involved. There's no dairy, no butter, et cetera, et cetera. Yes, 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 yes. Perfect. The food comes out. It hits the table. She starts digging in. And then I double check one more time. I said, just double checking. What kind of oil do you use? There's no nut oils, right? And she's like, oh no, there's peanut oil. And I'm like, oh my gosh, it's already like in her mouth.
It's like in her mouth. Yeah.
So she takes it out. I get out my EpiPen. I'm calling the allergist at the same time. And luckily enough, when the woman ran back to the kitchen, she found that it was actually refined peanut oil, which, thank goodness, what that means is they actually take out the proteins. So even though, yes, it's a peanut oil, it actually doesn't have the peanut proteins which trigger the reaction. So she luckily was safe, and we did not actually have to give that EpiPen, and she was okay. But wow, that was a learning experience as a food allergy mom.
Yeah.
Where you ask all the questions and you do all the things. And of course, their menu didn't have any labeling about anything. But then, from there on, it was really like, okay, we're going to pack her foods anywhere we go and be really, really careful about asking, but also trusting and being, safe with the information. So, lots of near misses. Obviously, I can go on and on about more near misses we've had, or even just plain reactions that we've had.
Yeah.
But really what it was is actually we went out for Mother's Day, the Mother's Day right before we proposed the bill. So it was May. And we actually drove 3 hours out to San Jose because we're Chinese and love dumplings. And usually, I had to learn how to cook for my daughter because I did not know how to make all these things. But I didn't want her to feel left out. So I learned how to make dumplings, and we usually make her dumplings at home. But that's her favorite food. And we found this restaurant that labels top 9 allergens. And we found that these dumplings didn't have sesame oil, which most do.
Oh, yeah.
So this one type, the chicken only, but not the pork. So anyways, we drove all the way there trying to check it out. They were super good about the allergy information, where we were ordering on their device, had full ingredient information to double check as well. So we felt really safe. She, for the very first time, had her entire first meal at a restaurant. We even brought backups in case, right? Because usually she just can have the rice, and then we give her all the food that we pack. But this time she had an entire meal. I literally, like, thinking about it, I still get teary. I literally cried, like, oh my gosh, this is so eye-opening for us, right? Yeah. Like, wow, simple labeling opens the doors for us. Obviously, restaurants have to have careful precautions and things like that. But, this really was life-changing for us. So from that, we're like, okay, well, why don't all restaurants do this? And is there a law? And, all these things. We found a law review by Elizabeth Doctorov from UC Berkeley. It was a great piece that was exactly pertaining to restaurant menu labeling. So that was really helpful. And then, did some research and basically drafted a 2-page proposal. And that October, we went to the Capitol to propose it.
How did you have a legislator in mind? Was it just like your legislator that you were a constituent of? Like, how did you find an author?
Yeah, really good question. So this is where being an NP and being involved in your professional organization, making a plug for NAPNAP, I know, just because I'm pediatric focused, obviously CNP is wonderful too. But, I was involved already with NAPNAP. So in San Francisco, I was a past president and came to Sacramento and said, wow, we don't have a Sacramento chapter. All of our dues are going to San Francisco. So in 2019, we kind of did like a reach out. We found people weren't interested. So in 2020, right before COVID and unknowingly, but that's when we founded our chapter. And so a lot of our meetings started virtually at first. But yeah, so I was the founding president of the Sacramento NAPNAP chapter.
Can you just tell us what NAPNAP stands for?
Oh, yes. Sorry. The National Association of Pediatric Nurse Practitioners.
Okay.
So there's 6 chapters in California. And so with Sacramento, now we have our own local chapter where, we were wonderfully placed in the capital of California.
It's good to have a chapter here. Yeah.
Yeah. So, and, before this, I did not have legislative experience, right? So after coming off being the president, I stepped into the legislative role and kind of was learning. And because it was COVID, we were doing a lot of virtual opportunities, right? So we started collaborating with all the other chapters for CEU events. And so that led to, hey, why can't we collaborate for legislative things? And so we kind of started this little collaborative. All the legislative chairs came together. We still are an ongoing and actually very active. And so it was a real success story from COVID, actually, where I then learned how to organize our first day at the Capitol for NAPNAP. And that was in March, right before that Mother's Day dinner. And so from that experience, Addie saw me doing that, and going to the Capitol and kind of, doing some advocacy on behalf of NAPNAP. And she's like, wow, well, we should do this, right? Can we do this? Can I go?
Let's get this restaurant thing going. Yeah,
exactly. Because she just started being interested as a food allergy ambassador with Red Sneakers for Oakley, which is a wonderful food allergy nonprofit. So she had just started getting interested. She did her first assembly at school to do food allergy awareness that May. And so, this was all kind of coming together. And so she's like, let's do this, right? And so I had learned the skills from being legislative chair with NAPNAP of, this is how you set up meetings. You literally cold call the offices and you give them your availability and you set it when you want and you line them up in a day. And going back to your question of how did I find an author was really just going through bios, right? So, okay, this is a health-related bill, looking at the Senate Health Committee, the Assembly Health Committee, who sits on those, but also who in their bio has medical background, potentially things like that. And so just kind of going through, because obviously no one's going to put in their bio, I have food allergies, right? But basically how we met Senator Menjivar was, she was an EMT in her past. She sat on the Senate Health Committee. And so that day, Addie and I went to the Capitol in October. We basically met with 8 or 9 offices and did our pitch. You know, Addie gave her spiel. I gave my little PowerPoint spiel. We had our 2-page proposal. And we met with, you don't meet with the senators or assembly members directly, by the way, you meet with their staff. But we met with their staff, who was really receptive. And they called us the next week and said, hey, we want to author your bill. So we got really lucky. And that's when they disclosed she actually has experiences with food allergies. So it really ended up being a good fit. And then for the next cycle, we actually found out she had been just promoted to chair of the Senate Health Committee.
Nice.
So kind of all these things came in line. That was really great.
Yeah. Awesome. And so you had an idea, you did some research, you proposed the idea to 8 or 9 different people, and you got one bite. What did the process look like after that?
Yeah, good question. So know that you do not have to be a lawyer. So I'm just like, oh my gosh, how am I going to know how to draft the word?
Reading California code is really hard.
Yeah, that is not your job. So basically, they have a legislative council. And before we actually, for sure, secured Senator Menjivar, there were other offices that were interested, but they're always balancing what bills am I going to go propose this cycle? How many can I handle?
They only have so much bandwidth.
Yeah. And some offices were like, hey, I'm not sure if we can commit, but I really want to see this moving forward. So we'll help you send this to Legislative Council to draft. So there's definitely that option as well, that you can have an office help you get it drafted, even though they're not authoring. So someone had offered that. And then when we heard she would be our author, obviously, we went with them. But there's legislative council, you give them. So I gave them the proposal with like some of the language that I wanted it to say and certain things that were really important, you know, just for background information. Mm-hmm. And then they do their research. They put it in their legal language. You go back and forth and you help edit as the co-sponsor of the bill. The other thing I should note that's really important. So we also wanted a really powerful co-sponsor, right? And so I'm passionate about food allergy, but that is not my professional role as a nurse practitioner in allergy. And so I went looking for a nonprofit organization. So there are some food allergy groups. I looked at Food Allergy Research and Education Fair. Eventually, unfortunately, that fell through. So then by February, AFA, Asthma Allergy Foundation of America, joined us as our co-sponsor.
Did you have a relationship with these people before you tried to or you were just like, hey, I have an author, this bill is in your, ballpark. How did you go through that process?
Yeah, it's so many cold calls.
Okay. I feel like there's a theme here. You're just like, I'm going to make this happen.
Yeah. You just cold call. Yeah. It's so funny. Actually, Addie and I had this mantra, during this. She's like, we are just going to be brave. Like, this is like, Aww. And that was like that was our song, like, be brave. Anyways, so I did reach out to FAIR before proposing it. So that summer I was trying to do some, hey, how can I get a little bit of bandwidth behind me a little bit going in? One, this was me being naive as a new advocate. So one of the stops that I made was that I connected with California Restaurant Association. If I did it again, I probably would not have done that. But I did reach out to them. I met with their CEO and their advocacy group. It seemed positive initially, but really they were just information gathering from me and then plotting their opposition. So big lesson in advocacy. I thought being really open about it. Okay, great.
Let's engage some stakeholders. Yeah.
I want to gather my stakeholders. They're high risk for opposition, but if I can bet their buy-in early, right? So that was my whole thought. So I learned my lesson. And, it was good because obviously the Senate office is very skilled at this. So once they signed on to author our bill, they said, thank you very much, but please stop communication with them because we have worked this before. So anyways, that was really strategic. But unfortunately, I let the cat out of the bag a little bit too early where they had a lot of lead time to kind of do some planning. So, but that was one of my first stops. And then before I met with them too, I also met with FAIR. So I reached out to them. Basically, how did I get their contact? Good question. I actually had found a food allergy nursing association as well, FANA. that was not an official nonprofit yet. And it, just started making friends. And so joined one of their groups, told them I was interested in doing this. They gave me the contact for FAIR's advocacy person. And so reached out to him, and he was very excited and interested because that was, they had been working on stuff restaurant related. And so early on, they were interested in co-sponsoring with me. Up until, unfortunately, after we introduced the bill, we got a call that they changed their mind, stepped off, and that's when I went looking for another co-sponsor.
And where were you, because you have your author and they're sort of invested at this point. Where were you in that process when they decided to drop out?
Yeah, it was crazy. It was actually Addie's birthday weekend. So it was interesting in January. Yeah. We had just introduced the bill, and so there was a lot of email action, right? Like back and forth all day. There's like a bill info sheet, it's called, right? Which is basically a 1 or 2 pager about the bill, where it says at the very bottom, the co-sponsors of the bill. So I was like, okay, great. It's live. Now I have free access to start sharing this and getting support, right? So I started sending it out to reaching out to some organizations saying, hey, this is a real thing now. Please sign on to support us. And they said, hold on, we have an edit. And that next morning, that's when I found out. So we were very early on, but the bill had already been introduced. But that left me in a lurch because
you need a co-sponsor now. Yeah.
Yes, and the co-sponsors, with FAIR, they are the biggest food allergy organization in the U.S. And so I was really depending on them to bring me all their connections with other food allergy groups and all the people that could help support and really help rally people together. And so once that happened, I was like, okay, I don't have any other contacts. And I need to get them. This is already introduced and it's real. So I had a little bit of panic moment, but you just kind of hit the ground running. And you use LinkedIn, you use Facebook, you use Instagram, you use all and every contact you have at your disposal. And definitely early supporters were definitely obviously NAPNAP because I was already a member, but CANP was super helpful. Our medical organizations, we eventually got California Medical Association, which was huge, SSVMS, right? So, I mean, those all came a little bit better later, the medical organizations, but CANP, NAPNAP early on, so grateful. I think it's really, that's why you want to be part of professional organizations. And, you basically, I did a lot of cold calling, a lot of website searching. You have that random number, you call and you email.
Back to the theme. Yeah.
So, but eventually it gained traction. Eventually I heard back from AFA and they were lovely and they jumped right on board. So February, they hired a state advocacy lead, Alexa Jordan. And so she and I hit the ground running. Yeah.
That's great. I'm super impressed that you could find a new sponsor in such a less than a month.
Panic. I had no context. So I was like, okay.
That's wild.
Start stalking people on LinkedIn. Hi, I sent you an email.
I we should get a t-shirt. Be brave. It's time to be brave. Yeah.
Yes.
So what do you like? So you're on the other end. It goes into effect next year, I believe.
Yes. So yes, it was signed into law in October. And then it goes into effect July 2026. And in the end, when it passed and got signed, unfortunately, the scope was limited to only pertain to chain restaurants with 20 or more locations. So that's where, there was some politics involved, obviously, things beyond me. But unfortunately, we did what we had to do to get it signed.
Yeah. I think sometimes you have to take the incremental approach and get things done. And I think there's nothing wrong with that. California is such a tough place to do any like politics. I have a friend who works in the bureaucracy, and every time he gets stressed and he's like, I just have to tell myself that I'm working for the 4th largest economy in the world, and that there are whole countries who have smaller systems than we do. So it's like, hey, you got an allergy bill passed in the fourth largest economy in the world. So
it's still monumental in my mind. Yeah. I agree. And I think from a food allergy standpoint, this is such a big step forward. I think the food allergy community is very, very excited because what it means is, finally there's a requirement. I think many other states have tried, and even in California, we had tried before, not me personally. But speaking to kind of more experienced advocates, this is something that, I wasn't the first. It was many people have tried, but things got watered down, where then it became have a food allergy poster, have food allergy training, have a notice on the menu that says ask your server. So that's what a lot of times it got watered down to. So so this is huge for us. So we're really excited.
And those California does tend to be a legislative leader. So even those, it is, it's unfortunate that it got limited, but those chains are in other states. They're, if they're gonna
a bit.
Yeah. It's not going to be just limited to California for impact.
Yeah. And these are the, just for background, restaurants with 20 or more locations are the ones that are affected by the nutrition labeling law with the Affordable Care Act that passed in 2010. So essentially, they already have to label the more in-depth information, calories and all that stuff, right? And so many of these chains already do provide allergen information. It's just not very easy to find. Or sometimes not all of them do. But, the big ones definitely do, but it's not like what we're asking for, which is a QR code on the main menu that links directly. A lot of times I'm Googling and trying to find it, and I magically find it. But when I actually go to the company's website, I can't find it, which is really interesting. So, sometimes it's hidden. But now with this requirement, it needs to be in plain sight, linked to a QR code if it's digital, or on the main menu.
Seems reasonable. Make it easy.
Yeah.
So what were your biggest takeaways?
Yeah, I would say number one, persistence. And being brave. No, I'm just kidding.
Yeah.
No, I mean, I think the biggest takeaway is really, how important collaboration is. Again, this is not a job that I did by myself, right? Surely I was the one following up and being kind of that persistent one out there. But it's really because of all the partners that I was able to help bring together. And you really using your connections. So, your professional connections that's what really helped save us in the beginning when I didn't have the organizations yet. Basically, we just did, it's not a petition, but basically it's a click link, right? Sign on to support. And essentially we got almost 1,000 people of individuals to sign on, and over 600 were medical professionals. So that already was really huge. We were able to have a joint letter with AFA with individual signatures listed, and then also organizations. And that organization letter grew after we passed our first hearing. And then certainly when we first passed the first house, which then we end up having 75 organizations in the end that signed on. So, but it definitely was incremental in the beginning. We're okay, we can't get the big orgs yet. We only have a few orgs and some small businesses, a few businesses. So really, we're just going to go after individuals and just say, hey, we have this long list of people that say yes, right? And so you just keep building, and people know other people who'd introduce you, meeting some more experienced advocates who introduced me to other organizations. So it's really all of that. And, I always tell them I'm the newbie in the room, please help me. I am not as experienced as a lot of people that I met during this, and made a lot of wonderful friendships through it.
Awesome. Well, coalition building is so important, but I think, having that, this is kind of why we're having this conversation in this podcast, is I think the stories are so you can be hey, labeling this enables my daughter to participate in the basic human social interaction of sharing food with people.
Yeah. 100%. And actually, the kids' voices were super impactful. So because my daughter at the out front wanted to be involved. And so she was the one giving the testimony. I actually never spoke at the hearing, which is interesting, right? So I sat next to her. Nice. And she's the one who gave her testimony both times at the Senate Health and Assembly Health. And we actually utilized her entire class. So for the Senate Health Committee, which was first, this is when we were still kind of gathering more momentum. I think this was actually a big turning point. You know, she was in third grade. Her teacher was amazing. Her principal was really supportive. We said, hey, can we make this into a field trip? And so we literally brought her entire class as a field trip. The parents of her classmates were wonderful, offered to volunteer and drive. We all went to the Capitol together. I was able to set up meetings for the kids to meet in groups of 5 with the legislative offices. And they had we made little, scripts for them. And they did even an activity with them of, hey, look at this menu. Can you tell me which ones has nuts? And of course they couldn't. And they said, yeah, that's why labeling is needed. And they gave some stats. We had this little script for them. They all took turns reading their part of the script. It was so awesome to see. And they enjoyed it. They were like, oh my gosh, they made posters. AFA flew out the day before. Alexa worked with them and they made posters and taught them more about the bill so that they felt prepared and ready. And then we organized a press conference that day. So we had a news outlet come, they were able to hear the senators speak directly to them. Addie and I spoke about it and our allergist spoke about it. And then they saw at the end of the day, the hearing where they got a chance to go up to the microphone, which was really impactful. I mean, you can imagine, right? Like all these kids lining up.
I'm ready to vote for them already. Like,
it was amazing. Yeah. We have it on our YouTube. It's on our website, but I will look it up. It still brings me to tears. Yeah. But I mean, that was a huge turning point for us where the health committee was like, oh wow. And even our opposition was like, wow, that's a hard act to follow.
100%. I'd like to get up and say that this will cost me a marginal amount of money. Like I can't, you can't follow that. I love that. Start them young, teach them advocacy. It's so important to be engaged at any age. That's amazing.
Yeah. And Addie likes to say, I learned to use my voice, even though I'm just a kid. So it's huge. Yeah. We had a little celebration with her class because obviously they helped us get this passed, right? So it was really nice.
I love that. I love that so much. I will definitely look up that. I will definitely look up the video. It was probably one of the more exciting health committee meetings that they'd had in a while.
Yeah, too. It was a packed room. There was like no seating. We actually, again, using your networks, right? So just like your mom friends, they came, supported me, brought their kids. They came to the mic. They don't have food allergies themselves, but they came to support. And, by the time we passed the first house and went to the second house, those food allergy families were driving from the Bay Area. And they came with their kids and they wanted to have a chance as well. So it's really amazing. I think, just really inspiring to see.
Mm-hmm, mm-hmm. So what's your next step? What are you planning? I know
big questions.
You didn't get everything you wanted in the bill. Like where are we going here?
I know. So, I think, yes, I do want to have another shot at it to, eventually one day have all restaurants included. I mean, that would be the definite gold standard. I think we're waiting for the first, result of our bill to roll out. Obviously, we want to see how that goes first in July so that we can gather more data and kind of see how that impacts the community so that we can use that information when we pitch it for all restaurants. Mm-hmm. So I think we're being, thoughtful about it all. The nurse practitioner in me, it's all about data, the scientific method, right? And so I've worked with now, not worked with yet. We're gathering the bandwidth right now. So there's some groups that do allergy research already. So we've met with them. AFA and I have met with them. AFA has their own medical director. And basically we're drafting a study. And so kind of just trying to get things together to be able to gather that data. Because what I've learned from this also is that what gets things moving is data, right? Just like in healthcare. So what the legislators really want to see is, will this actually make a change, right? And the most important data, it was, obviously based on research and a study being done, was that when you only verbally communicate your food allergies to the staff, over 50% of reactions are still occurring. When you label it on a menu and verbally communicate, that percentage goes down to 13%. So, wow, that was super impactful. So we use that all the time and kept repeating that stat, because this isn't just because we're asking for something because it's convenient for us. Like, it works.
Yeah.
And at the end of the day, it saves lives. Right. So anyways, but we've learned that we need more data, right? So this is going to roll out like in chains, like to show that this is actually working. That'll be really important when we bring it for the next round. And I think our next hope too is also, that's already really starting and active, is to bring it more states. So we're in talks already with some other states in the East Coast. Some of our advocates that kind of helped us and supported us with the Addie bill already in California. So it'll be Addie, different state. So Addie will be moving to other states. So really exciting. There's some states that are 2-year cycles. We're trying, obviously have to go through the same process again of finding authors and things like that. But at least we kind of have a roadmap now. We already have supporters that, are national organizations that would likely support again.
Yeah. So are you like, are you going to work with NAPNAP? Are you going to who, do you already have sort of like your team, or are you still building it?
Yeah. So AFA definitely is wanting to continue co-sponsoring. So they are really taking that lead with the next Addie bills. And, obviously each state will have to have their local advocates. So it was really exciting to see, after SB 68 Addie passed, a lot of people had reached out, hey, how can I bring this to my state? So we collected their information, tried to get groups together and kind of figuring out where to prioritize our energy, because obviously we can't do everything at once, but kind of where do we have the best chance? Where do we have the most resources and connections and an author, et cetera, et cetera. So I think that's kind of being laid out right now, because bill introduction usually happens at the earliest in December through early February. So this is really the season right now. Get those meetings going. Yeah.
This was fun. I really loved it. I'm going to check out that video of the Senate Health Committee meeting.
We have, if anyone wants to check out our website, it's addietellsall.com.
Awesome. addietellsall.com. Okay. Yep. Is there anything else that you want to add? Anything else that you think people should know? Yeah, I would say, don't be intimidated. I think the other lesson I learned is if you are passionate about something and, you just take it one step at a time. I think there's so much I did not know starting this, and you kind of just learn as you go, and you kind of just, you ask the people the right questions who do know, and it's making those connections and being open and vulnerable and being like, okay, I don't know, but you do, please tell me, and how can we work together? And again, just, it steps. You have to just take small steps to get there. But I think if you have a vision, if you have something in mind, start that first step and see where you go. That's wonderful. Very inspiring. Thank you so much for taking the time to talk to me. I think I learned a lot. I think other people will learn a lot from your story. And let us know when you want to come back and give us updates on this journey. It'll be wonderful. Yeah, I know. I can't wait to see it in effect in July. It'll be really exciting. And just kind of seeing where this goes. I think it's so funny because, the big first project for me was done, but now it's kind of ignited this passion in me. So now I'm like, what can we do next? Right. And so there's all these things that of course I want to do all of them, but I think it's really exciting. So we'll see kind of where it all goes. Cool. Okay. Well, have a wonderful evening and we'll keep in touch. Yay. Thank you so much, Laura. Yeah. And this was also wonderful, right? I went to my first CANP meeting and I got to meet you and here I am. I'm always there. Yes. Absolutely. Yeah. And if you know anyone who wants to talk about their own advocacy journey, let me know. Absolutely. Well, thank you so much for what you're doing with this podcast. This is really amazing. Awesome. Yeah, absolutely. Here's a little more information about the legislation discussed in this episode. Each year in the United States, 200,000 people require emergency medical care for allergic reactions to food. Of the 150 deaths, about 2/3 are children. SB 68 will require the top 9 allergens to be listed on restaurant menus, inspired by a European Union law in place since 2014, which requires the top 14 allergens to be clearly labeled. California is the first state in the union to enact such legislation. If you want to learn more, please visit addietellsall.com. That's ADDIE tellsall.com, linked in the description. It includes a video of the Assembly Health Committee hearing where Addie and her classmates have the opportunity to speak up in support of the bill. Thank you for listening, and please reach out to me, Laura at npadvocate.com, if you have any barriers you would like to discuss.